Good afternoon. Hi, and so in the next 15 minutes, I'm just going to provide a brief overview, somewhat of a snapshot of a number of the public health approaches that we really try to fund and support related to states, territories, tribal, and local communities. So in my division, we're in the National Center for Chronic Disease Prevention and Health Promotion at CDC. Our division is the Division of Nutrition, Physical Activity, and Obesity. We really think about a life course approach, much of which was discussed this morning. So really starting with getting a healthy start, considering breastfeeding and early child nutrition, growing up strong, where are those places that we can support healthy growth, and maintaining good nutrition, which really gets us into the community and family environment. So as was discussed this morning, really establishing healthy behaviors and eating patterns early in life can have long-lasting impacts. I'm going to touch upon this briefly on some of the support that we do related to breastfeeding initiation as well as duration, the role we have with continuing with the introduction and transition of family foods, and again, maintaining the best nutrition possible when children are outside of parental care, often in the ECE or early care and education setting, school and after-school settings. So starting with breastfeeding, as we discussed this morning, this has been a strategic priority for the CDC for a number of years, and we really work in three areas. One is hospital support for breastfeeding women. Much of the work we do here falls along with where the WHO has been on baby-friendly hospitals, so using a 10-step approach, an evidence-based approach to ensure that women are supported during those first 48 hours. Support for employed women. We know that many women don't meet their intentions related to breastfeeding duration because of lack of support in the workforce. And then community support. So we know from the data that African American women have a lower initiation and duration rates, and we're really trying to find innovative ways to really improve normative behavior and social support, especially among low-income and African American women. So the CDC conducts every 2 years a maternity practices and infant nutrition and care survey. This is basically a census of hospitals on the maternity care practices that are occurring to support breastfeeding. So we send out individual reports back to every hospital that fills out the survey. In a sense, it's an intervention in itself by really being able to do that self-assessment and see how you're doing. We send it to the state so they get the aggregate data of the hospitals in their area as well as territories. And we support then funding to really support the hospitals in making these improvements to get toward baby-friendly hospitals. So currently, over the past about 8 years, we've moved to have every state, DC, and Puerto Rico now having a baby-friendly hospital. This has been a Healthy People 2020 initiative, and so down in the bottom here you see that we went from only 1% of hospitals in 2005 being labeled as a baby-friendly hospital to now 21% in 2017. So we still have a long way to go. We have about 3,300 hospitals in the U.S., but really this 21% represents about another 700,000 babies that are approved in baby-friendly hospitals. So more can be looked at related to state-level supports in our breastfeeding report card that we put out every other year. This morning it was discussed in depth, so I won't cover dietary guidelines for Americans, but when we think about the work we do at CDC related to the evidence-based and guidelines, we also look at the sector setting guidelines. So the second one here is related to the ECE setting. So we look to the Caring for Our Children National Health and Safety Performance Standards guidelines for ECE, and this was the 3rd edition. When we look at that Caring for Our Children standards, it has many issues related to safety and other areas outside of what we consider in chronic disease, but there are 46 highly relevant obesity prevention standards that we look to, and these go across many areas of the caloric balance, such as healthy foods and beverages, physical activity, screen time, and breastfeeding. As we discussed, 4- and 5-year-olds can also be in school, so our school health guidelines, which the CDC uses through an evidence-based approach, also help set the standards related to nutrition. And recently we've updated the Federal Food Service Guidelines, which is an application of the Dietary Guidelines 2015. This really fits the bill related to healthy food in public spaces. So how are we supporting families and parents to have the best modeling behaviors for beverages? And this really can relate and be implemented in places like community hospitals, parks, community vending. The recent update that I'll talk about in a little while includes really these nutrition standards that directly align to Dietary Guidelines 2015 to 2020. Facility efficiency, this is related to resources, water, energy, and other areas. Food safety, which was missing from the first guidelines that we put out in 2011, as well as these nudges and behavioral design initiatives to really help build demand. If we offer healthier food and we haven't really brought along the public, they may not purchase that, and then the business model falls apart. So first I'm going to start with the work that we do to support state, territorial, tribal, and local ECE system strategies. This is called our Spectrum of Opportunity, and it really looks at the state systems that are available to support childcare. Unlike many groups who have worked in the school setting where we have federal standards, state and district, ECEs have a very kind of decentralized approach, and much of this does happen at that state and local level. And Natasha will be talking quite a bit about the licensing and regulation area. I'm going to highlight a couple of the other areas where we do have this opportunity to improve healthy beverages. Okay, so just back to our guidelines. So last year, for the first time, our division put forward a state indicator report on the early care and education setting. This really presents information about state policy and state system supports for obesity prevention in this setting. It covers 7 of the 11 from that peacock that I showed. Natasha's going to cover licensing regs. I'm going to go through a little bit on quality rating systems, professional development, and facility level interventions. Because as mentioned, policies can be a nice floor, but really the implementation level is where we need to get to change the practices that are occurring. So an example here is if we look at quality rating systems, also known as QRIS, we found that 39 states had a quality rating improvement system, but only 29 included obesity prevention standards. When we took a deeper dive of those 29, only 1 state included language specific to beverages or specific to sugar-sweetened beverages, and this was South Carolina. So this was an ABC childcare program. Other ones have a bronze, silver, gold approach. And within South Carolina, there were 3 levels, with A the highest. And the language in that QRIS is that sugar-sweetened beverages shall not be served, and this is for a rating of an A or a B. So as you can see, an opportunity area for states that do utilize QRIS. When we looked at professional development, we found that 42 states do offer online professional development for their providers. As Steve mentioned this morning, a lot of our providers, many of them don't have college educations. Many of them have associate degrees or just the high school courses that they may have taken as electives related to professional development. So we've been really working in the past few years to really improve free or very low-cost professional development. So as of a couple months ago, April 2017, we had almost 2,000 childcare providers took the module on healthy beverages. This is about 4,000 professional development units. And this is available on the Better Kid Care site, and so this has been part of the Let's Move Childcare initiative. So again, these are on-demand modules. Folks can do them any time of day, as long as they have computer access, and really is trying to help support really beverage improvements. From our state indicator report, we also looked at state-level support for facility-level interventions. So this is down at that child care level. So 47 states do promote or provide interventions, curriculums, or programs that can support healthy beverages. So the knapsack was mentioned this morning and looked at related to being a cost-effective intervention. We also, through Let's Move Childcare, which is continuing here in 2017, we've had 22,500 providers sign up to be part of the voluntary commitment. And then we know a number of interventions, such as Eat Well, Play Hard, have specific curricula development around beverages. And I've just included this example here on the Dairy Delicious.pdf here, where if you go through, you can see the substitution improvements for beverages. As long as we're talking about facility level, we also know that a number of these states are really trying to support both family homes and child care centers to take part in self-assessments. So in the school setting, we know a lot about the School Health Index. We've been working in those type of areas for a long time, but we also have this companion here in the child care center, as Steve Gortmaker mentioned this morning, the Nutrition and Physical Activity Self-Assessment for Child Care, or knapsack. Again, really helpful for key decision makers to understand the practices that they are doing around beverages, but it also allows an intervention in itself because there's an education component by filling out those self-assessments. We also have the Let's Move Childcare Advanced Checklist and the Contra Costa Self-Assessment Questionnaire. So this is an example of the paper copy that was included in one of the states related to Let's Move. So again, understanding again, is drinking water available when children ask for it, during designated times only, inside at all times, inside and outside. There's a lot of pragmatic aspects that go into every one of these categories, as Christina brought up this morning. Again, understanding more about portion sizes related to fruit juice and when they're being served. This issue we have around multiple occasions of the portions. Questions about sugary drinks and so forth related to milk. So our division does fund all 50 states and DC with seed funding. This is less than $100,000 usually for child care related to physical activity. In addition, 18 states receive a small amount of funding for nutrition, and this is part of our cooperative agreement that we term 1305. We also have a number of special projects and activities. And so one of those that includes nutrition is our mini coin. And so those are marked here with a gold seal. And then the large kind of flagship project that we've been working with Nemours over the past 4 years is our early care and education learning collaboratives. So you can see here in the purple shaded areas, we work with Nemours to provide support to states related to regional learning collaboratives, where we bring together folks from the child care setting and really help them work through action planning, curricula, and major improvements. Water was discussed this morning. CDC does have 2 toolkits available for free on our website related to drinking water. In 2009, we had a nutrition disparities meeting, and folks told us, we really can't come in here and tell folks to remove SSBs if we don't have safe drinking water. And so really at that time, we worked to ensure that the sectors and settings could really rally behind drinking water. Our school health branch at CDC has embraced a whole school, whole community, whole child approach. And as you can see here, as we discussed this morning, really the parent engagement and community initiatives really do support that school setting. And just wanted to include a picture here of the 9 guidelines related to nutrition that are part of our school health guidelines. But if you take a look at the comprehensive framework that's included in this whole child approach, we have a number of tools and resources that are available for local schools. This one is on the school nutrition environment and really walks through establishing policies for competitive foods and marketing, promoting healthy foods and beverages, and increasing access to drinking water. And this is also supported through our cooperative agreements with state health agencies. As I mentioned, we've updated our federal food service guidelines, and these can be adapted for states and other local areas, again, trying to reach parents and families in places like hospitals and parks. We have a number of case studies, which is important really for the business model, again, of working with private enterprises related to implementing these nutrition standards, and they can be found on our website. And we really do support a number of healthy hospital initiatives, really as being that anchor institution that can model healthy beverages for both workers, visitors, and others. And I just wanted to highlight here on the bottom of the slide, California actually through a CMS waiver has a healthy hospital initiative built into their state obesity prevention plan. Just a novel way to have CMS get more involved with improvements in healthcare. Outside of the child care and the school setting, I also wanted to again mention healthy communities. So our Community Health Media Center that's located at the uplink here includes initiatives from a number of communities across the U.S. that were part of the REACH communities, part of Pitch, part of CPPW, CTG, if you were involved with our local community projects. What we've tried to do is for those who are willing to provide their materials, they're within this media center. These are things like pouring on the pounds, Potter the Otter, drinking water, really so that communities aren't starting from scratch, but really can negotiate license agreements, whether it was for the royalties that went to paid spokespeople, really negotiate how they can just adapt those materials, especially related to SSBs and drinking water. I did want to mention, related to SNAP-Ed, which came up this morning, is that we've been working with the U.S. Department of Agriculture over a number of years here on inclusion of public health approaches within USDA's SNAP-Ed program. So SNAP-Ed is $400 million a year, and it really embraces individual or group education, social marketing, but also community support. If we just try to educate folks and they go back into a food desert, we're really not doing a disservice by really helping support them. So we have a SNAP-Ed Obesity Strategies Toolkit available through our NCORE group, which is the National Collaborative on Childhood Obesity Research. And we're trying to write a few case studies related to how folks are able to really incorporate SNAP-Ed funding through public health. Dr. Kari Cartwright is here, and she has a program based in Clark County, Georgia, where we're really excited to see SNAP-Ed being utilized with funding to improve the child care centers. And again, related to healthcare and the important modeling behaviors and counseling that can come from pediatricians, nurses, RDs, we have been working with AAP on the Next Steps counseling materials through a project that we worked with in Houston and Austin. We really worked to ensure that these were available in Spanish. So here's a link that now includes practitioner guides in both English and Spanish related to counseling on things including sugar-sweetened beverages. So we have a number of resources. I just wanted to let folks know online that a number of our state and local community supports are found online. And thank you very much for the time today.